All right. Hello, everyone. Let's see.
Good
People are
morning.
strolling in. Hi. Happy Friday, everyone. We made
Good
it.
morning.
Hey, Shay. I don't know about you guys, but I was speaking with others earlier. I was grateful to have Monday off because of Labor Day, but somehow I still had two Mondays throughout the week. Did anybody else have that problem? Just me? I'm the only one who has extra Mondays?
I think it was like 4 Mondays.
4 Mondays. Oh, yeah. Ooh, I'll count my blessings. 4 Mondays sounds very rough.
Plumbing all week. Always super fun.
Good. Well, welcome as everybody comes in. I'll go ahead and launch in, and we're going to have an awesome party today. So, welcome. If you have not met me before, I am Joseph Hill. I am the new Health Counsel and Public Health Specialist with the Alliance. Very glad to meet you all today, especially if it's the first time. I'm looking forward to meeting with you in other times. Today, we're here to talk about the New Mexico Aging and Long-Term Services. And we have our awesome guest, Chris Winterrode, who is the Aging Services Department, Consumer and Elder Rights Division Bureau Chief. So many of you already have, but if you haven't already, please introduce yourself in the chat, add your name, your county or tribal affiliation, and anything positive you want to share with the world today. Please note that this meeting is being recorded right now, so if you're on an FBI watch list or something like that, just at least just make sure you're going to be safe there.
There's a goal for this year, Joseph.
Yep. We want to acknowledge the land that we are on, so I will go ahead and read this. The New Mexico Alliance of Health Councils gives sincere gratitude for the opportunity to live and work here on ancestral and unceded lands that have been cared for by our state's original people of the Apache Nations, Pueblos, and Navajo Nation. We honor and respect the indigenous cultures, traditions, languages, and the rich contributions that continue to shape New Mexico. Together, we acknowledge the history and the impact of genocide, dispossession, colonization, and ongoing systemic inequities on indigenous communities. As a collective, we commit ourselves to working towards justice and reconciliation, dismantling inequitable systems, standing in solidarity with and respecting relationships with indigenous peoples. The Alliance affirms indigenous sovereignty, self-determination, and self-governance of New Mexico's tribes, pueblos, and nations. In offering this land acknowledgement, we encourage you all to reflect on your relationship to the traditional lands and take concrete actions to dismantle systems of oppression where indigenous peoples are empowered and celebrated.
Woo! That's
Yes.
what I'm talking about. Thank you.
Yes. I love the energy. Yes. Thank you. All right. So I've got a couple of updates to share with you before I hand it over to our wonderful guest today. First, just a reminder, if you haven't already, please make sure that you take the comprehensive survey. We're closing that off on the 15th. This is really important. This really helps us gear how we assist you and support you throughout the year, and also assist with our advocacy efforts. So please make sure to take that survey. You can get a $50 Amazon gift card. So, I mean, who doesn't need that, right? So please take that. If you need any information around that, please reach out to me or anybody on the team, and we'll get you sorted. Also, this year's membership agreements, please make sure if you haven't already. Many of you already have, but if you haven't already, just go ahead and take a look at those and agree to the agreements, I suppose. If you have any questions about those, please reach out to us. Again, that's to formalize our relationship. Just a few key things about the membership agreement if you aren't in a position to support the Alliance this year, I still encourage you to read through it and sign it for this reason. There's also an option to opt into the return on investment study that we're doing this year with UNM. This enables us to show how much that if our legislators invest a certain amount into our communities, how much they'll get in return. So my guess is for every million or $1 you put in, you get $1 million back. That's my assumption of values of health councils. But we're going to have that studied by UNM. They're going to compile that report for us. But we do need your permission so that we can access that data. And if that's something that you would like to help us with, and that can be very useful as well for writing grants for yourselves as well, please make sure that you check that box on the membership agreement. Any questions, again, reach out to the team and we'll help you out. Also, a couple of other highlights, which is you, really. We like to highlight you. Sam does an amazing job. That when you guys do something, we like to blast it out to make sure people across the state and maybe even beyond can see the awesome work that you're doing. So there's information on that as well. Maybe Sam can put the links in the chat. But we have a form where you can just simply show us what you did and we'll get it blasted out there for you. Also, letters of support for next fiscal year, the coming fiscal year. There's a link there as well for signable sheets to include letters of support to your legislators so that they continue to fund the awesome work that you guys are doing. As you know, Health Council funding happens year to year. And we want to make sure, well, we want to make sure a couple of things. Not only that it is supported for next year, but that they continue to support it and stop giving us nightmares every year, wondering what's going to happen with our funding. So make sure that you sign that letter of support so that you can continue to get support, as we should, from our local government or our state government in doing the awesome work that we're doing. Okay, I think I got all of the announcements. Let's see. Yes, and also we have a statewide meeting. I'm going to launch a poll right now. And that is well underway. Our statewide meeting is coming up very soon. We've had potential sites that we have this year that we've gone to before. So if you remember in 2024, we did it at Hotel Santa Fe. Another option is Hotel Santa Fe again this year, or Drury Hotel. That's another potential site. You see in the survey, and many of you have already taken it, those are the 3 options that we have access to. And we'd love to know what you're thinking. We have already pretty much got it approved. We're just waiting on the formal date. In the meantime, planning for not only the statewide meeting, but also Public Health Day is coming up soon. And we're going to have a meeting kickoff on the 27th from 12 p.m. to 1 p.m. There will be a calendar invite coming soon in your inboxes, so keep an eye out for that. I love that we get to get together in person, and if we can't in person, also virtually. But I also love that it's driven by you. So very excited for that and all that's coming up with that. Let's see, any other announcements? Oh, it's making sounds. Yes, and I'm very happy to introduce our wonderful guest today, Chris Winterrode. As I mentioned before, she is the Aging Services Department Consumer and Elder Rights Division Bureau Chief. She is a former teacher turned Medicare specialist. She has a master's degree in education and now enjoys working with the other end of the age spectrum. She is a strong advocate who enjoys connecting with and empowering people. She directs New Mexico's SHIP and SMP programs, which offer free, unbiased, expert Medicare information and assistance to New Mexico residents. Without further ado, I welcome our amazing guest. Digital round of applause from everyone.
Thank you, Joseph. I am super happy to be here. Let me see if I can get these slides to work. I don't seem to be able to advance. Or did you want me to share? Do you have my presentation loaded up, Joseph, or do you want me to get it loaded?
We can do either one if you'd like to go ahead and share, or I can share it and I can advance them for you. Either one's fine with me.
Okay, so let me, we discussed this, but apparently we did not get into the details.
That's okay. I can share it on my end if you like.
Let's see. No, I've got it right here. Don't worry, I just didn't have it open. And in the meantime, let me just say while I'm getting myself organized here, how deep my appreciation of health councils go, just as a little bit of background. Some of you may know me. I've gone to a lot of health council meetings in my day. I discovered the Alliance of Health Councils during the pandemic. At that time, I was a SHIP coordinator, and my role was to, let's see, let me make sure I can you see my slides? No, I don't think I'm sharing yet. Hang on, let me. My role at that time, as our current SHIP coordinators do, was to provide updated Medicare information statewide. And boy, during the pandemic, that was super important, obviously. You're seeing my slides now, right? Let me just get into present mode, and then I'll be ready to get back on slide target with you. Now, are you seeing the land acknowledgement now? No. Okay. It's opening in a different window from the one that I'm sharing. So let me just get my act together here. So at that time, the executive director was Sharon, and I called and we talked, and I started really trying to work with as many health councils as possible to get out information during the pandemic. And since then, my role has shifted a couple of times, but I have brought with me sort of that critical partnership between the SHIP and SMP programs and the Alliance, because boy, there just is no better. It's just such a natural partnership as far as I'm concerned. I am just having trouble getting this to take up the whole screen. So please bear with me as you see the slide that's coming as we go through this, because I'm gonna quit fighting with it. So I'm now the bureau chief. And so basically I've worked my way through every job in this joint. I started out as an options counsel. I'm going to be telling you more about them in just a minute. And then I became a SHIP coordinator, and our SHIP coordinators are our on the ground outreach throughout the state. And then I became the supervisor of those programs. And now I'm the bureau chief and I direct the grants, right? So, I love this role because it allows me to really develop and put our money where our mouth is in terms of our partnership. We actually have a contract with the Alliance, and hopefully that will be, not hopefully, as long as I'm here, that's going to be an ongoing partnership that we have together. And I can talk to you more about how that works later. Our land acknowledgement, I'd like to share with you now. The Aging and Long-Term Services Department recognizes the Indigenous peoples past and present that have been stewards of this region since time immemorial. These lands are home to ancestral caretakers of numerous Pueblo tribes who would come to include Mescalero Apache, Jicarilla Apache, and the Diné Navajo Nation. Each of the tribes has preserved and retained their language, stories, traditions, and maintains profound cultural ties to the land. As we come together today, we recognize and honor the significant contributions of all Native Americans. ALTSD also acknowledges tribal sovereignty and tribal self-determination and is committed to building connections with tribal leaders, advocates, and stakeholders who share our mission to support lifelong independence and healthy aging among New Mexico's older adults and adults with disabilities. Okay. Today, we're going to go over the Aging and Disability Resource Center, what it is, what options counseling includes. We're going to learn about the State Health Insurance Assistance Program, or SHIP, the Senior Medicare Patrol, or SMP, and then some other ADRC programs as well, and other programs within the Aging and Long-Term Services Department. So when you call the ADRC is the 1-800-432-2080 number that is going to be tattooed on your brain by the end of today's talk. When you call, it's the call center for the state, right? It is the entry point to all aging and disability, aging and long-term service department programs. And you're going to speak to an options counselor. That's the job title of the people who answer the phone in the call center. They have the main thing that they do is really try to listen to what people need and then connect them with the resources in their area, right? So the ADRC is not a direct service provider. We're a connector. They help people understand what their options are, what services are available, and the pathways to access. One of the big things that we talk about is the Home and Community-Based Waiver, which is the Medicaid program that covers in-home caregiving services. So that really constitutes a lot of the calls that come into the ADRC, but they get calls about everything under the sun. Really, my advice to everybody is if you're facing a new issue and you're just not quite sure what to do, like you feel like there should be some help or some resources out there, but you just don't know how to get them, call the ADRC, because they are going to help get you on the right path to whatever it is that what you need to face, whatever challenges is heading your way. I tell people all the time that aging is undiscovered territory. It's like you can't really prepare for it. You don't know what's coming. And when it gets there, if there's help available, this is how you get started accessing it, by calling the ADRC at 1-800-432-2080. We can provide short-term assistance with things like getting applications filled out, in today's and tomorrow's world where access to benefits is becoming more challenging, and more of the federal benefits in particular are requiring people to fill out things online, which just is not feasible for many of the people that we work with. They can call us and we will help them with it. So it's just a really good thing to keep in mind. The Home and Community-Based Waiver is the Medicaid program that pays for in-home caregiving services. I think we're all aware that we have a rapidly aging population, and not only is the long-term care infrastructure of skilled nursing facilities and assisted living facilities not anywhere near the capacity of people who could potentially need it, but I haven't talked to anybody who's like, woohoo, let's get me into a nursing home. People in New Mexico have a strong preference for aging in place. They want to stay in their homes. The Home and Community-Based Waiver is the Medicaid program that can help people do that. You cannot apply for it directly from ISD. You can't go to Yes New Mexico and apply for the home and community-based waiver. I can't tell you how many people we've talked to who've like, oh, I tried that and they just gave me family planning. People get really crabby about that. The reason for that is the home and community-based waiver requires I'm going to call it a pre-assessment. Because the basic eligibility requirement for this benefit is that you meet a level of care need for in-home services. You have to have that pre-assessment before you even go to the point of being invited to apply for the benefit. That assessment happens at the ADRC. You cannot get there any other way. So if you know of someone or you speak with someone in your community who needs in-home caregiving services or is frustrated with, just isn't quite sure how to get that, the thing to do is call the ADRC at 1-800-432-2080. This is a very in-demand benefit, and it has a long waiting period, right? But this is how you start. If you haven't been to our website lately, check it out. It has recently been redesigned, and it makes me happy to go there. It's much better than it used to be. One thing that I want to point out on this slide is if you go under news and events, which is right here, the calendar will pop up and you will be able to see statewide the SHIP outreach and counseling events that are happening in your community. So we do a lot of outreach. And this is a way to find out what's going on if you haven't already heard from your SHIP coordinator. On the website, we also have live web chat available. Sometimes people get frustrated if there are long hold times when they call the 800 number. This is a great shortcut. The person who handles our web chat is Tariq. He's of Moroccan heritage and he doesn't look anything like that white lady, but that's our icon. So there is a real person who sits right across the hall from me who handles the web chat. So if you have questions and you're frustrated or you don't want to deal with the phone, get on there and chat your question in. And if Tariq isn't able to answer it, he will forward it to me and I'll get somebody to call you. Okay. SHIP is the State Health Insurance Assistance Program. There's a SHIP program in every state and territory in the United States. So I'm a state of New Mexico employee. We're a state of New Mexico program, but we have this national connection. We're funded through grants through, last I heard it was still ACL, but we'll see what happens, tomorrow. The SHIP program is contracted to provide expert, unbiased information and assistance about Medicare. Now, I don't know what you're hearing out there, but there's a lot of scared people out there who don't know what's happening with their benefits. They don't know what changes are coming. And so, boy, we are so happy to connect with them. And we don't have answers either because, I don't know, my crystal ball broke at least 6 months ago. But what we can provide is that reassurance of knowing that somebody is there, we're there, and we will, as we get information, we will share it with you and we'll work with you together to make sure that you're able to get what you need. We don't sell, endorse, or recommend any kind of insurance, right? We're just here to help people understand how their coverage works, what their options are, cut through all of the noise that surrounds Medicare. And there's a lot. And to just really focus in on what do I need? What are my options? How am I going to make the best choice for my particular circumstances? That's pretty much our whole goal. The other program that's also like SHIP, part of a federal network, there's an SMP program in every state and territory. Senior Medicare Patrol helps educate people on how to protect themselves from healthcare fraud. I mean, it's another, so frustrating. Feels like everybody, not just older Americans, but we all have a big giant target right on our forehead. And it is amazing how easy it is, because they're constantly coming up with new ways to get you to do something dumb. So if that happens and it's regarding Medicare or Medicaid, our SMP staff is there to help people, minimize the damage, figure out what to do next, report many of these things. I mean, the sad fact of the matter is, often people can't get back what they lost, but they can at least make sure that they're protected from that point forward and start to learn how to protect themselves in the future. One of the biggest fraud trend in New Mexico right now in terms of Medicare fraud is new Medicare cards. Somebody contacts you saying, oh, I just need some information so I can send you your new Medicare card that's plastic, or it has a chip in it, and that's not happening. I think it was 2019 when they sent everyone new Medicare cards. Prior to that, the Medicare cards had Social Security numbers on it, and they changed it at that point to protect people, right? Because we really need to protect our Social Security numbers. So they changed the Medicare IDs to a random combination of numbers and letters. And it was a big deal when they sent those out to every Medicare beneficiary. That is not something that happens without a huge push. So our Senior Medicare Patrol is really out there trying to educate people on how to protect themselves and provide some guidance about what happens if, somebody slips through your defenses. We also have a prescription drug assistance program through our office. This program is for people who are insured or underinsured, who still cannot cover the cost of their prescription medications. And so they connect people with the pharmaceutical companies' patient assistance programs, and often can help people get their medications for free or low cost. So this is a very important program because we really don't want anybody not taking their medication as prescribed because they can't afford it, right? That's not good for anybody's health. Also under the Aging and Long-Term Services Department umbrella, we have Adult Protective Services. Adult Protective Services, I'm gonna just give my quick little APS pitch. People often associate adult protective services with child protective services, right? And nobody wants CPS showing up on their doorstep. Adult protective services is really significantly different from child protective services, because with adults, the first thing that happens is they're asked if they want help, right? And they're assessed by the caseworker as to whether they have the capacity to make decisions for themselves. And if they have capacity and say, no, thank you, I don't want any assistance, then then the caseworker walks away. It's done, right? This is something that's been so frustrating for family members and community members. They're like, that person really needs help. They're not okay. But if we go out there and they say, no, thank you, then we're done, right? Because they have the capacity and the right to make decisions for themselves, even if it's a bad decision. So that can be really frustrating. But it's also really important to know that Adult Protective Services is there to support people to have the resources that they need to be independent and healthy. They're not going to remove them from their homes. They're not going to do anything that the person in question doesn't agree to. Right? They remain in charge of their lives. Adult Protective Services is the home of our New Mexicare program. That's a companion program to the home and community-based waivers. They're not connected, but really, I was describing earlier how the home and community-based waiver is the Medicaid program that helps pay for in-home caregiving and helps people stay in their homes. New Mexicare is an aging and long-term services department program that's under the APS division that is for people who don't qualify for Medicaid. So they have too much in resources because Medicaid is a resource-based eligibility program as well as the need for care. For people who have just a little too much to be able to get the Medicaid program, they can apply to New Mexicare. And it also is a program that provides caregiving. So that's a very important thing to know about. And when you talk to an options counselor, they will direct you to that benefit if it looks like you're over income for the home and community-based waiver. The long-term care ombudsman program goes in and oversees and investigates issues in long-term care facilities, right? So they go into nursing homes, they handle resident complaints. They're always on the lookout for volunteers because there are, I believe, over 300 facilities that they work with in New Mexico. And obviously we don't have 300 ombudsmen. So we're always looking for volunteers. Care Transitions is one of the best programs that nobody knows about in the state. Basically, Care Transitions provides services for people who are leaving a skilled nursing facility. They need to have been there for over 90 days, but if a person has been in a nursing facility for over 90 days and they're returning home, they can request Care Transitions assistance. It is free and there are no eligibility requirements. And somebody will come out, they'll help them through the discharge process. They'll make sure that they have all of the durable medical equipment, everything that they need for a successful transition back into the community is in place for them. My family used this program when my father-in-law was returning home after an extended stay at a skilled nursing facility when he had a hip replacement. They were amazing. They were amazing. I mean, it was so comforting to my mother-in-law to have somebody, because she was scared to bring him home. She didn't know if she could handle it, right? Because they were both in their 80s. She couldn't do a lot of heavily physical care for him. So they came in, my husband was there with her. They did a tour of the house. They, made recommendations about where to put up like little grab bars and handholds. And then my husband went in and did all that. And he was able to be successful in his transition back home. So it's a great program. All of the senior centers, they're not administered through the Aging and Long-Term Services Department, but they're associated with us. And then the Office of Indian Elder Affairs is also part of the Aging and Long-Term Services Department. So there is a lot going on here. I should have probably said this back when I was on SHIP, but I was on a roll. So for the SHIP program, we have 5 regional SHIP coordinators, and hopefully you're going to recognize these names because they come to your meetings. Here in Santa Fe, in the Northeast region, we have Stephanie Gonzalez. In Albuquerque, it is Angela Futch. In Farmington, in the Northwest, it's Evangeline Red Steer. Down south, in the Southwest, it's Melissa Luna Ramirez. And in the Southeast, we have Kathy Lay, right? So the five of those incredible people, each cover a region. They attend health council meetings. They provide Medicare updates to you regularly. And if you need to connect with any program within the Aging and Long-Term Services Department, they're your contact, right? So I can, after we're done here, I can put each person's region and their email address for you in the chat if you're not sure how to get a hold of them. My email address is already in the chat. You're always welcome to reach out to me. I didn't put my phone number because I don't answer my phone. So it could be a long time. If you try to call me, it could be a long time before you hear back. So to sum up, if you call the Aging and Disability Resource Center, as I said before, is really the starting place for all of our services. So you'll get options counseling if you call in to that 1-800-432-2080 number. We screen everyone who calls for low-income programs because we really want to get them connected with those benefits that help make those limited incomes go as far as possible. We provide information and assistance. We help connect people with the programs in their local area to support healthy and independent living. We are, as I said, the starting place for the home and community-based waiver, which is part of the Medicaid Turquoise Care. You may get a referral to the SHIP program for either short-term assistance, or if you get into a tricky Medicare question, all of the options counselors are SHIP certified. So they all have basic Medicare knowledge, but our SHIP coordinators, work with it in a lot more depth and have a deeper understanding. If there's any kind of fraud issue or question that you have, that's the place to start. People needing help with their prescription drug costs. If you want somebody to come out and be at a community event, do a presentation, provide enrollment assistance, call us. We will be there. And of course, you can also get all of that through our web chat. And this is me. So take a picture. It'll last longer. This is the 800 number. Like I said before, I put the 800 number there because they will bug me and get me to call you. Whereas if you just leave me a message on my cell phone, good luck. That's what's going to get me fired someday. You can follow us on social media, and we have a monthly newsletter that you're welcome to subscribe to. I would absolutely be grateful if you would go to this website and take our survey. We're required by our federal grants to have a certain number of surveys, so that would help me out. So I can put that in the chat also. And last but not least, here's the basic ALTSD info. And I'm ready for questions.
Awesome. Thank you so much for that. I wanted to open it up. Does anybody have any questions for Chris?
I have a question for you. Please send up a heart or a reaction if you're aware of the SHIP coordinators coming to your meetings. Oh, I like it. And any feedback you have for me about that, like how that works for you, if you'd like that to be different, if you want something different from them, if whatever, I would love to hear that too.
Also, if you have some questions, but you don't want to unmute, that's okay too. I'm keeping an eye on the chat. And we've had some good conversation in the chat. Appreciate that. Okay, we have a question out of Quay County. Let's see. Long-term care becomes more challenging when a person has mental health issues. Is there help for that? That's a good question.
It sure does. So generally speaking, so there's several pathways. Let's just say that. So we certainly can help people deal with any Medicare related issues, like is Medicare covering something? Is it not? What's the problem? What's the pathway? So that kind of thing is fully within our wheelhouse. Now, we have had some just absolutely heartbreaking situations. There was one gentleman, the wife that I worked with she was down in southern New Mexico, like in the Lovington area. And her husband had dementia and he was violent. And no one would take him. No one would take him. Right? She couldn't get him in anywhere. She couldn't handle him at home. And so, unfortunately, facilities, we can't make them take someone. I mean, we can't do that. I think what we ended up doing in that case was actually getting them connected with adult protective services, because he wasn't safe and neither was she. And they worked them through sort of the casework process to get the supports that family needed in place so that nobody was in danger, right? That's one of the great ways that adult protective services can really support people. So, it's a complicated question, probably not a very satisfying answer, but if you have that kind of situation and you call us, we will help you work through all of the options.
Oh, more in the chat. Another issue in that regard is that when this can become an immediate or urgent issue, placement in facilities for care is difficult to begin with. Mental health diagnoses, it becomes much more difficult because you have limited options. Great idea to include the other agency.
Right. So, I mean, Val and I have had this conversation so many times. When I started at the ADRC as an options counselor, and I started hearing every question under the sun that people call in with, I mean, I was shocked. You would think I would not be that shockable, having just come from public education, where you also see everything. But what surprised me was just how close to ground our safety net is. I was like, oh my God, what do we do about this? And so part of the reason that I just am happy to be where I am is that really from the first few months that I worked here on, my goal has been to tighten up our safety net, right? And that's why this partnership, I feel, is so incredibly important, because you can't connect people to resources that you don't know about, right? And the more powerful and dynamic our relationships, the closer the weave is on our safety net, and the better job we can do helping people before they hit the ground, right? So now you know my philosophy of life. Let's tighten up that safety net, work together.
Thank you. One more question in the chat. Do SHIP coordinators with ALTSD work with managed care organizations, care coordinators for care plans, follow-up referrals, etc.?
The short answer is no. Now, the longer answer is that sometimes we do if there's a problem. So the SHIP coordinators get referrals a number of different ways. They get referrals directly from people in the community when they're out in the community. The SHIP coordinators each do a minimum of 10 community events every month. So that's 50 SHIP events statewide a month. We don't always quite hit that. Sometimes we exceed it, right? So they are out in the community a lot, right? Look for them, go to our website, look for their events. If you want them to come and do something in particular, invite them, they will be there, right? So they're out there, they get direct referrals from people in the community and sometimes from health council members who know somebody and then speak with them about it and get them connected. They also get referrals through the ADRC. So somebody will call in to the ADRC, talk to an options counselor, and the options counselor will put through a referral. The other big way that we get referrals is through the governor's office, right? We handle a lot of constituent issues for the government, the governor's office, for things that people have called in that, that they're not happy about. And sometimes those things are related to issues with the MCOs or not getting the level of caregiving or the quality of caregiving through the MCOs that they're looking for. And, if those kinds of things come up, we do work directly with the MCOs to solve those problems. And if necessary, refer them up the chain within, HCA, who oversees the MCOs. We can make things happen.
Awesome. So any other questions that want to be entered in the chat? Or is there anything, Chris, you would like to say? Anything else?
Well, I would like to congratulate Martha Munoz. She's actually being trained right now as an in-kind SHIP volunteer with us, and she passed her SHIP certification, her national SHIP certification exam yesterday. So woohoo, Martha.
Thank you.
So excited to be working with her. She is working closely with Melissa Luna, who's our SHIP coordinator down in southwestern New Mexico. And just really excited with this partnership. And your other new benefits navigator, I think I have her name written down here somewhere. I just talked to Val about it yesterday, from Laguna. It is going to be starting that same process. So very, very excited about the ways that we can work together. I also want to share a little bit about some of our other partners. We just entered into a really great partnership with the Department of Health Disease Prevention and Control Program. And we're doing coordinating some events with them on cardiac health and also diabetes. I know both of those issues are major health concerns in most of the counties in New Mexico. So if you would like to coordinate with the SHIP coordinator and our partners at DOH to get some of that information into your community, please get in touch with Vanjie, Missy, Kathy, Stephanie, or Ange, right? And they can bring that into your community. Really, we want to be relevant to you by bringing the resources that you need to your community, because that's what makes us all stronger, right? That gets our safety net where it needs to be. Another partnership that we've had in the past and by January we'll be rocking and rolling with again is with the Senior Citizens Law Office, bringing legal clinics, legal resources, help with all kinds of legal issues into communities, particularly in those small rural communities that may not have access or may not know how to access free legal advice and assistance. So these are, and we're also in partnership with the Roadrunner Food Bank and their affiliates throughout the state. So talk to us. We have a lot of resources to share with you.
Oh, I've got one more question in the chat. What types of services does the Office of Indian Elder Affairs offer? We can also connect offline about this. That was from Geraldine.
Right. So Geraldine, the Office of Indian Elder Affairs works closely with the senior centers in tribal areas. Right. And we are working with them. We're working with them. Our team is working with them to make sure that we enter those areas as respectfully as possible and making sure that that they have all the access they need to the information, right? That equity issue. So that's really a lot how we work together. I would be so happy to have a separate conversation with you about that and how the Alliance might connect with them.
Thank you, Chris. Happy to do that with you once I'm feeling much better, probably next week.
Oh goodness. I hope you do feel better. I'm sorry you're under the weather. This is a little bit of a fire hose. So if you think of something later, or if something comes up next week and you're like, oh man, who's that lady again? Right? You have my email address. Joseph has the slides. He can send them out to you. Please don't hesitate to get in touch with me because I hope this is going to be like one of those things where like you've never heard of it and all of a sudden it's everywhere, right? So even if you don't know how you would like to connect now at any time in the future, we're here for you.
Good stuff. Well, as we enter our final minutes here, just want to thank everybody for attending again. I definitely want to thank Chris for sharing all of the amazing resources. It's just grateful to know the good work that you're doing and that you continue to do across the state. So very, very excited that people are more informed about it and will be more informed about it. If there are any other questions, please reach out to Chris or the team at the Alliance. We're here to help you. We're here to serve you. All of those emails are there. We got a lot of emails. We're actually adding another person to the team next week. So we're just going to keep on adding emails. You can reach out to the one that makes the most sense to you. Also, hey, it's still Friday. So very excited that it's Friday. I hope everybody has an amazing weekend. If there are no other questions, comments, statements, or complaints, we'll give you back, let's see, 6 minutes in the day.
Woohoo. Thank you, everyone. I'm so happy to be here with you today. And I hope I hear from you soon.
All right. Have a good one, everyone.
Thank you.